Greeting of the day to everyone. My name is Hormotrnya Pungrop and I'm going to talk about peripheral vascular disease. Let us look at the outline. What is peripheral vascular disease? Peripheral artery disease, peripheral venous disease, symptoms of peripheral vascular disease, causes of peripheral vascular disease, the risk factors for peripheral vascular disease, diagnosis of peripheral vascular disease, treatment of peripheral vascular disease, problem list, physiotherapy management for peripheral vascular disease. What is peripheral vascular disease? Peripheral vascular disease is the disease. It could be blockage or obstruction of the blood vessel, that is the arteries or veins, located away or outside the heart. PVD most commonly affects the lower limbs. Peripheral vascular disease can significantly affect the patient's ability to stand, walk, or climb stairs. Peripheral artery disease. Peripheral arterial disease most commonly occurs when atherosclerotic plaque produces localized stenosis of the arterial lumen. The most common symptoms of mild or moderate PAD is intermittent claudication, defined as walking-induced pain, cramping, aching, tiredness, heaviness in one or both legs, most often the calves, that does not go away with continued walking and is relieved with rest. Peripheral venous disease. Venous insufficiency occurs when the venous system is unable to provide adequate antegrade blood flow back towards the heart, that is the venous return, and fail to prevent retrograde flow into the extremities. Physical symptoms of venous disease include ankle edema, subcutaneous fibrosis, brownish skin discoloration, ischemia, and dilation of subcutaneous vein. Arterial pulses are usually present. Symptoms of peripheral vascular disease. The symptoms of peripheral vascular disease include muscles cramping, muscles weakness, cold extremities, pain, and the pain can be intermittent or persistent in nature. May accompany blue or pale limbs, reduced hair and nail growth on the affected limbs. These symptoms can be mild and unnoticed, or they can be severe and cause significant reductions in ability to move around and carry out a normal active life. Causes of peripheral vascular disease. Some of the causes of PVD are as follows. Vasculitis, injury to blood vessels, may be by accident or damage to the blood vessels during surgery. Tissue ischemia can also cause of atherosclerosis or other abnormalities of arteries. Example, Raynaud disease. Stress, cold environment. The risk factors of peripheral vascular disease. Some of the risk factors for peripheral vascular disease are age above 50 years, high cholesterol, cigarette smoking, diabetes mellitus, high BP, family history of PVD, obesity, physical inactivity. This for peripheral vascular disease. Peripheral Vascular disease can be diagnosed by medical history or assessment or examination by using Doppler ultrasound, angiography, CT scan, or MRI. Treatment of peripheral vascular disease. Most of the symptoms of peripheral vascular disease can be reduced by modification of risk factors like stop smoking or limit or stop drinking of alcohol, encourage for regular exercises, and so on so forth. In severe cases of peripheral vascular disease, more invasive treatment options may be considered, such as angioplasty or bypass surgery. Occasionally, the individual with peripheral vascular disease may require amputation of the limb. Problem list. Problem list can vary from patient to patient. Some of the common problems experienced by the patient are as follows: impaired range of motion of involved extremities, edema, presence of or risk for skin breakdown, impaired mobility, impaired endurance, impaired respiratory status, impaired balance, impaired strength, knowledge deficit regarding precautions, activities progression or healing process, pain, sensation deficits. Physiotherapy management for peripheral vascular disease. Commonly used physiotherapy treatment for peripheral vascular disease are mobility, such as bed mobility, transfer, gait on level and unlevel surface with an appropriate assistive device. Positioning. Positioning should provide appropriate splint to protect, immobilize, or relieve pressure and elevate extremities. Edema management by using compression or active exercises and elevation can also be done to control edema. Range of motion, strengthening, stretching exercises. Active assisted passive range of motion and stretching as tolerated can be performed to preserve and increase flexibility and strength. Resistive exercises as tolerated can increase strength but also improve circulation and decrease claudication. Important point to remember is to not overstress the incision. Endurance. Progressive ambulation and increased repetition and frequency of exercises can increase a patient's activity tolerance. Pulmonary conditioning. The patient can walk or use a treadmill or stationary bicycle or other type of aerobic equipment and start at a low duration and then increase the time and frequency of activity gradually. Thank you.